Hello. Thank you for inviting me to participate in the 2020 Green Party Presidential Nominating Convention. Our theme this year is climate justice, social justice, and economic justice, and I'm going to speak about health justice. The Green Party platform is very strong when it comes to health justice. And Ralph Nader, when he was our presidential nominee in 2000, was the first presidential candidate to really put single-payer health care in the national spotlight. Here we are 20 years later, and healthcare justice is a huge need. The COVID-19 pandemic and the recession have made health injustice prominent and really exposed the flaws of our healthcare system. So when it comes to the COVID-19 pandemic, the United States has ranked very poorly in terms of handling it, and we continue to see very high numbers of cases and high numbers of deaths, especially compared to other countries where they've been able to really lower the cases and lower the deaths. When we look at countries that have handled the COVID-19 pandemic well, we see some basic features of their healthcare systems that really are different from what we have in the United States. One is that they have universal healthcare systems, so every person can seek healthcare when they need it without worrying about whether they can pay for it or not. They also have leadership that has given clear guidelines about the pandemic, how health professionals should handle it, how the population should protect themselves. And they have centralized planning, so they were able to get health professionals to the areas that needed them the most and also get supplies to the areas that needed them the most, and to really increase the production of supplies to meet the demands. What we've seen in the United States has been a very sad competition between states who are fighting to get basic needs like masks and gowns and ventilators, and the corporations are just price gouging and playing the different states against each other so that they can make a profit. Another feature of the countries that have handled the pandemic well is that they treat healthcare as a public good, something that everyone should have, not something that people are privileged just because they're able to afford to pay for it. And the recession, which began back in February and was sparked in part by the COVID-19 pandemic, but really we'd been expecting one for a while now because the foundation of the economic system in the United States is very faulty, with high levels of debt, a lot of people experiencing economic insecurity, low wages, you name it. And so since the recession began, tens of millions of people have applied for unemployment benefits. And a study that just looked at March until the beginning of May found that of people who lost their jobs, 31 million people also lost their health insurance. Now, we're a few months out from there, and things haven't changed, so we can expect that probably tens of millions of more people have lost their health insurance. And that's on top of the 30 million people who didn't even have health insurance to begin with. And then we have tens of millions of more people who are underinsured, so they have health insurance, but they can't afford to pay the out-of-pocket costs, like co-pays and deductibles and co-insurance, and so they face serious financial barriers preventing them from being able to get medicines they need or testing or just seek care. So in this environment, this is a really important time for us to be advocating for health justice, and healthcare has been a number one issue for voters in the past several years. So this is an opportunity for us as the Green Party to really stand out and shine compared to the corporate parties, because neither of the corporate parties is really addressing this situation of healthcare injustice. So we do this by reaching out to people in our community, holding educational events, showing people how wonderful our platform is, and encouraging them to get involved and join the Green Party. So what is health justice? Well, we advocate for a type of single-payer healthcare system. And that could be like a national improved Medicare for all, which would be like our traditional Medicare system where it's paid for publicly, but it's delivered both publicly and privately. Or it could be a national health system like the Veterans Health Administration, where it's completely public. It's owned by the government, financed by the government, operated by the government. And both of these would be much more efficient and improve health outcomes it's significantly over what we have right now. So what are some key features of a single-payer healthcare system? One is that they're universal. Every person living in the United States would be covered. No questions about how much you make or this or that. If you're a person and you live in the United States, you're in the system. Coverage would also be lifelong, from the time that you're born until the time that you die, and completely portable. So if you change jobs, you go to school, you move, travel in the United States, wherever you are, you're covered by the healthcare system. This also means that you can seek treatment wherever you need to in the United States. So if you have a particular condition and the best place for that condition is not in your state, you can go to that best place and be covered. It also puts healthcare decision-making back in the hands of patients and health professionals without an insurance company standing in the middle and making you jump through hoops or preventing you from getting the care that you need just because they need to make a profit. And it would be comprehensive. Your whole body is covered from head to toe: mental health, dental, vision, hearing, preventative care, inpatient, outpatient, rehabilitation, substance abuse, things that you might need at home, community care. All of that would be covered by the system because that's the most efficient. And a single-payer system is really simple. It's easy to use for health professionals and for patients, and that may help to really eliminate the serious physician burnout that we're seeing right now in the United States, where doctors are getting so frustrated with the system and having to fight all the time just to get their patients the care they need that they're burning out in like 10 to 15 years. Another feature of a single-payer system is that it would be transparent and accountable to the population. It's a public system, so we have the right to know how our healthcare dollars are being spent. And we advocate for a system in which people are able to participate in shaping that system. This is part of the pillar of our party of participation or democracy, that people have a voice in how that system works. So if you look at our presumed presidential nominee's platform, I helped to write his single-payer healthcare position statement. It advocates for a national health insurance and then a national health system, and one that is run at the community level and decisions are made at the community level. This is what real health justice would look like. So we have an opportunity now as the Green Party in this time when there's so many crises to really show how we stand out from the corporate parties. This is an opportunity for us to be out there speaking about this issue, organizing events, speaking to people in our community, and showing them why the Green Party is the party that they want to participate in. It's the party that represents their needs and their interests. So I'm happy to help out. If you ever need someone to speak or you need information, just reach out to me and let's grow the Green Party together and let's organize and win health justice.